Hi everyone, I'm Berit. I live in St. John's, Newfoundland and Labrador, and I would like to acknowledge the island of Newfoundland as the ancestral lands of the Beothuk and the Mi'kmaq, and Labrador as the ancestral lands of the Inuit of Nunatukavut and Nunatsiavut and the Innu of Nitassana. I completed my practicum placement with Dr. Carolyn Sturge-Sparks at the Healers of Tomorrow Gathering. And really briefly, I would just like to draw your attention to the logo that you see at the bottom right of my slide here. This logo is unique to the Healers of Tomorrow Gathering, and it was designed by our planning committee and incorporates aspects of the various Indigenous groups throughout the province, and it'll be on each slide as we go through this presentation. So historically, there has been a shortage of healthcare professionals throughout Newfoundland and Labrador, especially in rural and remote communities. The province also has a shortage of Indigenous healthcare professionals, and this leads to negative health impacts because Indigenous peoples not only have to leave their loved ones and social network behind to access health services, but in most cases, they are treated by a professional who doesn't speak their language and doesn't understand their cultural practices. This can cause misunderstandings and ultimately lead to culturally inappropriate care, which is a contributing factor to Indigenous health inequities. So to address these issues, Dr. Sturge-Sparks, Memorial University of Newfoundland, and the Indigenous organizations throughout Newfoundland and Labrador have created the Healers of Tomorrow Gathering. The Healers of Tomorrow Gathering was established in 2015 and is a summer health careers camp for Indigenous youth in grades 9 to 12. The camp provides youth with information sessions on healthcare professions that require either university or college training led by healthcare professionals, and elders, healers, and knowledge keepers lead sessions about Indigenous medicines and healing practices. The camp's goal is to increase the number of Indigenous health professionals throughout the province, ultimately increasing Indigenous health equity and wellness. The camp hasn't been evaluated as of yet, so my practicum project was to develop a program evaluation plan. This plan has 3 phases: an environmental scan, a stakeholder and rights holder analysis, and the development of surveys and interviews. I'll describe each of those phases in detail shortly. The purpose of this project was to evaluate the impacts the camp is having on Indigenous youth and their communities, and to gather information for the future modification and enhancement of the camp. The environmental scan was conducted to determine if there are similar programs to the Healers of Tomorrow Gathering throughout Canada, the United States of America, Australia, and New Zealand. We took an in-depth look at the camps identified to determine how the Healers of Tomorrow Gathering compares to other camps, and to determine if there are ways in which the Healers of Tomorrow Gathering could be improved. A web-based search was used to find similar camps, and only healthcare camps that focus exclusively on Indigenous youth were included. Throughout the scan, we found 4 similar programs throughout Canada, 1 in the United States, and none were found in Australia or New Zealand. Several comparisons were made between the camps identified and the Healers of Tomorrow Gathering. First, all of the camps have the same rationale, which is to promote interest in their professions and to encourage Indigenous youth to pursue healthcare careers. Second, all camps had information sessions on healthcare professions. However, the Healers of Tomorrow Gathering had the most comprehensive list of presentations, as it highlights 10 professions, which is at least 2 more professions than any of the other camps, and it covers a wide range of both university and college programs. Third, all of the camps identified in the scan have a basic science component. However, the Healers of Tomorrow Gathering does not have this component, placing all focus on Western and Indigenous medicines. Fourth, all of the camps provide Indigenous teachings, but during the scan, it was noticed that the Healers of Tomorrow Gathering goes a bit further. Unlike the other camps at the Healers of Tomorrow Gathering, elders, healers, and knowledge keepers not only come to campus to present to the youth on Indigenous medicines and wellness, the youth also travel off campus to take part in Indigenous gatherings. This provides youth with hands-on experience and further immersion in Indigenous cultures. Finally, unlike the camps identified, the Healers of Tomorrow Gathering also offers a wellness component. Youth take part in nutrition and cooking classes, in addition to art therapy, drama, and music sessions. Throughout these sessions, youth learn more about healthy living and ways to sustain wellness. So although the Healers of Tomorrow Gathering appears to be a more comprehensive camp, the environmental scan also indicated ways the camp could be improved. First, the Healers of Tomorrow gathering could provide youth with mentors. Mentors could provide youth with information and advice on prerequisites and program planning, which could help them achieve their educational and career goals. Second, the camp could provide youth with Indigenous role models. What I mean by this is that we need to focus on having Indigenous health professionals lead the information sessions on healthcare careers. In doing this, there is a potential to reduce perceived barriers, thereby increasing the number of youth who see themselves in a healthcare profession. Over the past several years, the camp has been improving on this. And finally, the camp should work to integrate Indigenous and Western healing and medicines. By both being present in health service delivery, more of the health needs of Indigenous peoples can be met, leading to culturally appropriate care and a more comprehensive and effective healthcare system. The second phase of the project was a stakeholder and rights holder analysis. The purpose of this analysis was to determine who the stakeholders and rights holders of the camp are, and from this, who to engage with using surveys and interviews. For this analysis, stakeholders and rights holders are defined as those who are affected by the camp, who can influence the camp and have interest in the camp. It is important to note that Indigenous peoples and groups prefer the term rights holder because, unlike stakeholders, in many circumstances, a program or policy has the potential to impact their constitutionally protected rights, which have been historically ignored. By using the term rights holder, Indigenous rights are recognized and respected. And for this analysis, stakeholders and rights holders were identified throughout brainstorming sessions between Dr. Sturge Sparks and I. Once stakeholders and rights holders were identified, they were then separated into three categories: proximal, intermediate, and distal. Proximal refers to those who are directly impacted by the Healers of Tomorrow gathering and include changes in an individual's or community's knowledge, behavior, and health. Intermediate refers to those who are impacted indirectly by the camp and are those who offer resources, services, and supports to proximal stakeholders and rights holders. And distal refers to those who are also impacted indirectly by the camp, but unlike intermediate, they are impacted farther downstream and represent the general public as a whole. Once stakeholders and rights holders were separated into the categories, various characteristics were then analyzed. These include their role in and impact on the camp, whether they support the camp or not, their level of influence on the camp, their level of interest in the camp, and the potential to take on a leadership role in the camp. Once the stakeholder and rights holder analysis was complete, Dr. Sturge Sparks and I wanted to identify several key stakeholders and rights holders to engage with at this time. To do this, we decided to use stakeholders and rights holders with the highest influence on and interest in the camp, in addition to the ability to take on a leadership role. Based on this criteria, the key stakeholders and rights holders are youth who have participated in the camp, their parents and guardians, elders, healers, and knowledge keepers, Indigenous communities and organizations throughout Newfoundland and Labrador, planning committee members, and Memorial University and the College of the North Atlantic, which are the educational institutions involved in the camp. For the final phase, surveys and interviews were developed to engage with the key stakeholders and rights holders. The purpose of these surveys and interviews was to determine the impact the camp is having on the career choices of Indigenous youth, and if the camp has impacted the health and wellness of the youth and their communities, to assess participant satisfaction with the camp and provide additional opportunities to suggest ways in which the camp could be improved. Dr. Sturge Sparks, the planning committee, and I decided to develop a survey to engage with youth who have participated in the camp, while all other key stakeholders and rights holders will be engaged with using interviews, as more information is acquired through interviews, and storytelling is a very important aspect of Indigenous culture. 4 interviews were developed: 1 interview for parents and guardians, a second for elders, healers, knowledge keepers, and Indigenous community members, a third for planning committee members who represent Memorial University and the College of the North Atlantic, and a 4th for planning committee members who belong to an Indigenous organization. Survey and interview questions were developed using a combination of pre-existing questions from surveys and interviews, as well as questions developed by myself and Dr. Sturge Sparks. During the development of surveys and interviews, great care was taken to ensure culturally competent language and to be mindful of Indigenous worldviews. So in conclusion, I will be continuing on with Dr. Sturge Sparks to conduct and distribute the surveys and interviews and compiling and analyzing the results. And the findings from this project, the surveys and interviews that will be conducted soon, in addition to the Healers of Tomorrow gathering as a whole, has the potential to impact public health practice. For example, similar camps could be created across Canada and internationally. New public health policies could be developed to improve Indigenous health and wellness. And a lot of collaboration goes into the planning and organization of the Healers of Tomorrow gathering, and these Indigenous and non-Indigenous partnerships could be further supported throughout public health practice. I would like to thank my supervisor, Dr. Carolyn Sturge-Sparks of the Faculty of Medicine at Memorial University, the Healers of Tomorrow Gatherings Planning Committee, Dr. Nigel Livingston, and the School of Public Health and Social Policy here at the University of Victoria. And I am happy to take questions now.
Well, thank you very much. Excellent presentation. Were there any questions from the audience? While people are thinking, I'll ask you a quick one. In terms of just the numbers of participants in the camps, can you give me some idea of sort of how many participants that you had?
So the number of participants have increased over the years. I think the first camp, I may be wrong, I think it may have been 11 or 12, but now for this year, we're looking at around 22 participants. So it is increasing.
Excellent. There's a question from Brittany.
Oh, hi, Berit. Can you hear me?
Yes, I can.
Hi. Amazing presentation. Incredible work. I just had a question. So the camp focuses on youth. So I think you said from grade 9 to 12. Is there any, I guess, youth that would be in any post-secondary, or is there any like student capacity where a university student could like volunteer?
Yeah, so the camp, as I mentioned previously, the camp started in 2015. So the youth are definitely, some of them we know of that we've kept in contact with, we know are in post-secondary right now. And in addition to that, one thing that I haven't mentioned is we also have program leaders in the camp. So those are university students who, I guess, what I would like to compare them to are camp counselors, I guess. And students, previous youth that have taken part in the camp can definitely take on one of those camp leader roles, which I think, personally, I think that would be another way of, I think it would also address my recommendation of a mentor, not in the same capacity that I discussed, but I still think that a camp leader could definitely take on a mentor role if they were to do that. And we would love for previous camp attendees to take on that role.
Oh, I'll actually just add one more comment too. You should also look into, it's called SING. It's actually, it's the summer internship for Indigenous peoples in genetics and genomics. So it's not health, it's mostly focused on genetic health, but they're worldwide, like they have teams in the States, New Zealand, Australia, and we just introduced one in Canada, and I think they're looking at Hawaii too.